The reason we got the name of the Dirty Dozen was we started out with 24 people in the class, and through various attritions, one person was pregnant and dropped out. Someone else got into it and decided they didn't like it. So we ended up graduating only 12 people. And that was right about the time that the movie The Dirty Dozen came out. So we adopted that as our nickname, The Dirty Dozen. And so that kind of stuck with us all these years. And how things have changed, oh wow. We had to polish the teeth with the belt-driven handpieces. We actually had to use a little syringe that was called a chip blower to dry the teeth off. So some of the new equipment is just, people would be mortified if they would go back and see some of the things that we actually had to deal with at that time. Our uniforms at the time were white nurse dresses, and we actually had to wear nursing caps. The gal that was the head of the program would go around with a yardstick to make sure that your dress was a certain length. I think it had to be 2 inches below the knee. And she would actually take a yardstick and measure to make sure that you were within the guidelines. And because you figure back in the 70s, we were doing what? Hot pants and, short skirts and all that. And at the time, there were temporary buildings that were on Halsted Street, kind of a little bit north of Almer Road. They were basically temporary units that were there for classrooms. The dental clinic was actually at St. James Hospital on the 6th floor. So we'd had a lot of traveling back and forth to do with our equipment and things like that. Because you're in such an intense learning environment as far as not only the didactics of it, but the hands-on of learning how to do a trade. That we've just stayed together all these years through marriages, divorces, deaths, the whole 9 yards. So it carries through. And there's 2 of us that are still working. I think when you get a patient that's really afraid, and there's a lot of people that are very, very scared to sit in the chair, and to win their confidence of realizing that it's not going to hurt and they're going to get quality work accomplished in their mouth, I think that's the part that really, really is great, is the reward of seeing somebody just totally turn around and be trusting of you and comfortable with having the work done.